On Thursday, December 30th, 2021, the communities in and around Boulder County, Colorado experienced what is to date the most destructive fire in the state's history. While the area was accustomed to dry conditions, high winds, and even wildfires, the unpredictability and devastation of the Marshall Fire was unprecedented. This fire, which started as a wildfire but rapidly evolved into an urban conflagration, was fueled by extremely dry vegetation and wind gusts that reached 115 miles per hour. It burned everything in its path as it jumped over a 6-lane highway with ease. Entire subdivisions were decimated despite the heroic efforts of hundreds, if not thousands, of emergency personnel. Approximately 35,000 individuals were evacuated from their homes with little to no time to grab personal belongings. The fire also threatened a number of residential care facilities and hospitals, forcing them to evacuate vulnerable and critically sick patients into a healthcare system that was already incredibly stressed due to the COVID-19 Omicron surge and staffing shortages. The following day, New Year's Eve, as snow fell from the sky, the community was able to take in the full impact of the Marshall Fire. Just over 6,000 acres had burned, with 1,084 homes destroyed and 159 structures damaged. While the damage assessment and recovery process is ongoing, it is estimated that the fire caused more than $2 billion in losses. Remarkably, there were no serious injuries to first responders. However, tragically, 2 members of the community did lose their lives. The communities that were impacted by this historic event continue to recover and rebuild their lives. And while those first responders and healthcare workers who worked tirelessly to protect their communities are working to heal and recover, they also recognize the importance of sharing their stories and learning from this incident so that they and others can be better prepared to respond and save lives. This 4-part Marshall Fire Learning Series brings the stories from fire and EMS responders, the hospital evacuation team, residential communities evacuations, and the efforts provided for regional coordination.
Welcome, and we're so excited to be able to take this opportunity to present to our partners after the Marshall Fire response. My name is Chris Campbell. I'm the emergency manager with Boulder County Public Health. We play the role of ESF8 in these disaster and emergency responses, which is the public health role. And it really is a good opportunity to put information out there about lessons learned and help our partners across the state and across the country deal with a really unfortunate disaster. And I'd like to go ahead and introduce the panel.
Hi, I'm Becky Seamers. I am the Executive Director of Balfour Retirement Community in Louisville. On the night of the fire, I was responsible for my facility, which was skilled nursing and assisted living, approximately 90 residents. We're also on a larger campus with approximately 400 residents in which we supported evacuating the entire campus that night.
And I'm Katie Paniga. I'm an epidemiologist with Boulder County Public Health. During the Marshall Fire, I was on a COVID-19 response team with Boulder County, and we helped support residential care facilities that night.
And I'm Michelle Seppels. I'm the Senior Executive Director of Balfour's Louisville campus. Along with Becky and her team, we helped to support the evacuation of our entire campus. Specifically, my role was to help support the evacuation of our memory care, which is about 1.5 miles from the ignition point of the fire.
Yeah, it is important to frame the conversation a little bit. So from a public health perspective, there was a lot going on that evening. So there were 9 long-term care homes or assisted living homes in the community that were impacted, some very quickly, and this was a remarkable scenario. Additionally, public health supports other areas when folks evacuate with access and functional needs. So there was a lot going on that evening. And I think it's really important to frame the conversation that way for our partners listening, trying to learn from this experience. I think it's important to look at some of the best practices we've learned from our pandemic response. We've really built a structure in the state working with the state health department and local partners, working with long-term care homes to be prepared. In the emergency management world, it's great because we tend to look at things, how we can improve and continuous quality improvement, which is why we're doing this session for partners and community members. We really did build a great structure and partnerships to help support the long-term care homes in Boulder County, and we called on that support the night of the Marshall Fire. And maybe Becky can speak a little bit about what was going on the ground with the homes and what they were looking at.
Yeah, so, we all have our disaster plans, we have them, but I think if we learned anything that night, that our disaster plans are really built solitary within, and we need that bigger conversation. And we had some of that because of COVID. We had gotten to know people, but we hadn't really worked on those disaster plans as far as who would have thought that we would have had a fire that night that was so rapid and so quickly moving. How were we going to get the transportation? Where were we going to move them to? I remember early on in that day, watching the cloud of smoke, and I thought I was far enough, my building was far enough away from the building, but our sister facility and Michelle were much closer. And so we sent Balfour has quite a few vans, and we have transportation, but we sent them all to Cherrywood. And they were in the process of evacuating when it became apparent that we were going to have to move too, but we had no transportation. And trying to pull that together and using our partners to help us get school buses there, get families there, things that were not addressed in our emergency plan because who would have thought? And so I guess that's that. Right now we think about, we have to think about it all. It really can happen. You may not think it's going to happen, probably not a hurricane, but definitely a fire. So, Michelle?
Yeah, I would absolutely agree. My past history in disaster management has always been more related to events like snow and hurricane and stuff like that, where you have several days of advance notice and can really put together a plan that supports your infrastructure with the immediate disaster, but also the days and weeks that come afterward. I think the Marshall Fire, because of the fast movement, really compromised our ability to utilize those disaster plans, because we had to continuously change and adjust our plans in order to meet the needs of our residents in that immediate crisis. So it was definitely a very different disaster to respond to.
Yeah, and just going back to that, when things were moving that fastly, our staff, we didn't have times to sit down and read our disaster plan. We had to know it, and so the practicing and knowing and having people. Looking back, and the number one lesson I learned was practice of your disaster plan is crucial, because people need to rely on some kind of muscle memory when something like that is moving that fast. You have to be ready to act, and it's not time to sit down and train people at that moment.
I would add to that, it's an important, again, lesson learned. We've, knowing your resources and talking with partners in terms of transportation. Oftentimes when you try to partner with public health or ESF aid or the Emergency Operations Center, it takes a little while, one, to understand the situation that's going on, what's going on the ground, and then also to mobilize resources. So in a fast-moving event like this, I really encourage our partners and us to talk about emergency plans, look at them, go through scenario-based planning and discuss that and say, what will we do in this situation where we need to move all of our residents very quickly? Do we have the transportation we need? If not, who can we call? What is our backup plan? That is a real big lesson learned. And I would go through all different types of scenarios, from severe winter weather to something like a Marshall Fire. Talk that through, bring in lots of partners. I spoke a little bit about partnerships. So the state health department and the staff that work with long-term care homes were crucial in helping connect with all the facilities and homes in Boulder County to make sure they were safe and see if they needed resources. So that was a great partnership. We worked with the North Central Region Healthcare Coalition. So your healthcare coalition partners are crucial. We were able to really move over some of the transportation issues we had and needs to the coordinator of the Healthcare Coalition to help us out and have a key point of contact, because because of relationships, so that was really key. So that's a big lesson learned out of this.
Talking about partners, we were talking about this earlier. I think we need to make sure trade organizations too are critical and will support you. And if for no other reason, to belong to an association, knowing that they would have your back in a situation like that. So the Colorado Healthcare Association was right there, supporting us, getting resources, bringing beds, arranging moving vans, bringing things that other facilities that weren't affected, supplies to us. They were able to coordinate all of that because, of course, we were moving so fast. We did not have the ability, and we took our med carts, and things like that, but we didn't necessarily take pillows and bedding and different things that our residents needed. We tried, and we later went back and got those things, but at the moment, having those supports being gathered for us by our trade organization was critical.
Yeah, yet another real important thing in a fast-moving event that our partners should think about watching this training video is decision making. So, oftentimes you're hoping to get situational awareness, you're talking to public health. We're not on the ground there. First responders are. It's a very chaotic and fast-moving incident, something like the Marshall Fire, unfortunately. So sometimes you maybe just need to walk outside and look at your environment, see what's going on. Have these things worked out with your leadership ahead of time about who's going to make some of these decisions, gather as much intelligence and situational awareness as you can, and act. And certainly know that there's partners out there to help. Stay very connected, have points of contact and phone numbers so you can have those conversations and then come to important decisions during these disasters.
And I think knowing your capacity, how fast it is going to take you to evacuate, and it takes a whole lot longer than anybody than you realize. But the Louisville campus, depending on the map that you look of the Marshall Fire, was not actually ever in the evacuation zone. However, when we stepped outside and we had ash falling on our head and it was still hot enough to burn you, it was time to go, because it was going to take us a lot of time to evacuate 400 people. And had we waited and had the wind shifted and the weather didn't change and they got the fire out, we could have easily been there and we couldn't have gotten people out that quickly. So I think knowing what your capacity is and when you pull the plug and when you need to go. And I don't regret a second for us not moving, because it could have gone very different.
Absolutely, and I think following the warnings that are coming from the offices of disaster management and emergency management are so important. One of the major things that I heard, in several conversations after the fire was that, when that initial warning to evacuate is sent out, most people think that truly is just a heads up, we may need to move, but the reality is, especially for facilities and caring for people at volume, we should be thinking about that as soon as that warning comes out and acting right away. If nothing else, it is an exercise to make sure that your disaster plan is working and functional, but taking that time and saying, let's wait until it's official, can sometimes absolutely cost you the minutes and hours that you need to keep your people safe.
Yeah, one other thing that was going on, right, we're in a pandemic during all of this, so one other thought in facilities' heads as they're evacuating is several of those facilities were in a COVID-19 outbreak. They were in an active outbreak status. They had residents who were sick. And so having that thought of infection prevention and, spreading communicable disease, but trying to get residents and staff out, that was another part of, added stress to this situation. And so really important that when we're in emergency evacuation situations that resident and staff safety comes first. It takes precedence over communicable disease. It takes precedence over everything else. And so just, another thing to keep in mind.
Yeah, the transportation component is one I think again, our partners listening need to think about. So think about safe way. Think about safe travel patterns. Think about training for those who are driving or providing that transportation, and just continue with the conversations again. These are ones that are going to continue as lessons learned from the Marshall Fire response of how do we best interact with the first responders on the ground through their incident command. How does the Emergency Operations Center and Public Health, for example, help with those transportation scenarios and how they are sending drivers into a safe environment. They know where they're going. They know the safe routes in, the safe routes out. So I think that is a next step for us as we're working through this scenario. It's important, I think, as you're doing your disaster plans, emergency plans, you're looking at your transportation options. Keep safety in mind as well. And ultimately, I think we were successful because of that, but it's one that we did send some folks maybe into some scenarios where they didn't feel safe. They were able to make it in and out. So we're going to keep that in mind as we continue to plan together.
And have several deep, because the plans you think you have are going to fall apart. So have different scenarios thought about, which I thought we had our buses, but we had sent them to of course, the facility that had to be evacuated first. But then they were originally going to come to our building, but then when everything changed, we had to send them to Longmont. So that took all of our transportation out of the picture for a couple hours. So then we were hoping, families were coming to pick up people, but they were having trouble getting through the traffic. We had all hands on deck from our home office. They were helping with transportation, and we were able to get some vans from other facilities, again, based on Carle Healthcare Association, helping us out in mobilizing transportation to the building. On the night of the evacuation, like I had said before, we had sent our transportation to Cherrywood, and when it became apparent that the fire was approaching rapidly, I don't know how else to put it, and we never got the word that we had to evacuate. We were in conversation with Chris and EFS 8. We made the decision to evacuate. We didn't have transportation, and so at least for the campus, communication was critical. We do use a system across the campus called LifeLoop, and so we were sending mass messages to our families. We also had a couple people, I had a couple of our front office folks making phone calls to families and getting as much family support as we could, knowing that the transportation getting there would be a challenge. So a lot of our residents were transported by family. Our home office came over. We brought all available vehicles, and we were putting residents in the cars, and most of our residents got transported by cars and other people. However, we did have the skilled nursing who were in wheelchairs, so that was our bigger challenge. We did get a couple ambulances. I believe Chris got those sent to us. And then we did get, CHCA sent us a couple of our other other facilities that weren't being affected, sent vans to help transport our wheelchair residents. And honestly, we had a lot of residents that we had to just pick up and put in cars and then transport their wheelchairs separately because we did not have a way, lessons learned. And hopefully you wouldn't have to do that. We had several work comp injuries that night of staff hurting their backs, physically moving residents. I am happy to say that none of the residents got hurt though, which was my number one concern that night as far as the transportation. So
absolutely. For our community, Cherrywood Village is an offshoot of the Louisville campus. We're about 3 miles away from the main campus. So like Becky said, most of the transportation was diverted to us. For our community, we had kind of a succession of challenges. First, obviously, being getting transportation there, which was challenging at times throughout the evacuation. There were moments when, with our facility right on McCaslin Boulevard, which is right in the heart of the evacuation zone, there was periods of time during that when buses were not allowed through. There was also challenges in that the original event started during our morning shift, and ultimately we had morning shift members who did need to leave us and go respond to their own families and situations, but our afternoon shift was not allowed through the barricades. So ultimately, we had to kind of reconnoiter with our afternoon shift when we got to our evacuation point. But ultimately, we had 7 different vans that came to respond, and at the conclusion we had about 2 vans worth of residents remaining, and our Balfour vans were no longer allowed through the barricades. So there was a point when we were trying to decide which residents we could put in cars and determining a safe way to get the remaining few residents out of the community. Ultimately, we were very lucky in that we had 2 RTD buses that were deployed to us, and we were able to load all of our remaining residents as well as all of the wheelchairs, because we had to lift our residents onto buses that were separated from them while we were evacuating. So it was a pretty intense coordinated effort of both resident coordination of their supplies, coordination of medication carts, and getting them to our next point, and ultimately all of our staff. And our final bus rolled out of Cherrywood Village at about 7:00 p.m. So I think we discussed this earlier, but absolutely know the time it takes to evacuate your building, because it is much longer than you expect. So.
I'd like to go back to that point on communication, and just, again, preparedness is a real important thing, again, to think about for our partners watching this. So know how you're going to connect with key partners that can support your response. So it might not have gone as well as it could have for us for the Marshall Fire response. We had been actively all together in this pandemic scenario. There had been a lot of institutional knowledge loss, a lot of turnover. And so we did have to kind of go through our partnerships, or those that we know, to connect together. So what I would say is, from an ESF8 perspective, we have on-call staff 24/7 to support you no matter what the scenario is. And so make sure as you're preparing, I would just encourage homes and facilities to think about that. How are you going to connect with emergency management? How are you going to connect with public health? Get those numbers, make sure they're easily accessible, and ultimately empower staff to go to those relationships. If you're unable to make a connection, keep calling. And ultimately, that's what we did. We were able to connect and start to talk together about situational awareness, what things were happening, how many residents we were talking about, the fact that there might be an issue with transportation. We were able to start thinking about additional supplemental transportation. So another lesson learned is keep contacts up to date. Keep those in your plans, and if they're not, certainly empower staff to leverage those relationships they have to get the support they need.
Yeah, and so from my team's perspective, so in March of 2020, with the pandemic, we created a long-term care, Boulder County Public Health created a long-term care facility team that specifically worked to support communicable disease and COVID-19 within the 45 or so long-term care facilities in the area. And so our team, up until the Marshall Fire, had several years of contact and building relationship with residential care facilities in the area. And so, a real unique advantage that we had is because of these relationships built, we were able to, get in contact with facilities. Facilities were calling us, letting us know that they needed to evacuate. They needed some help finding other facilities in the area that maybe had capacity. And that capacity went beyond just bed capacity. That went beyond, extended to staff capacity. That went to levels of care. They may have had residents that were memory care or assisted living that needed a certain level of care. So not only do they need a place to stay overnight, they also need staff coverage that, is another huge part of this. Security. There's a lot of other things that went into, needing to get residents to other facilities. So that was, a huge advantage of our having Boulder County and the residents or the long-term care facilities in the area having this relationship built. And I wanted to go back to the contact point that Chris had made. Another part of this is all of this really started with us getting connected to the long-term care facilities after hours. So important to not only share contact information from business hours, but also after hours, overnight, weekend coverage. Super important to have that information current. And so, as staff turnover, stuff like that, maybe might be helpful to have part of the onboarding process as adding that to your plan of whoever comes on, contact information is updated, because that is critical in situations of emergency, connecting with other facilities in the area. Local public health, OEM, and the state are all trying to get in contact. So really important to have that contact information constantly up to date.
Well, and on that night, if you had that information and you could reach out and let people know, again, we were moving so fast. You didn't have one person that could just sit there and answer phone calls, and the phones were ringing and ringing and ringing. It was families calling in. It was, what are you doing with my mom? And then we had emergency. And so being able to take your emergency conversations offline, like on a private cell phone or something, so it's not the phone that your families are trying to call in on, or other people, that you have a private line that you can get right to them and leave them messages and they can get to you, I think were really important. And so that night I did have one of my employees was working the phone. She's a much faster texter too than me, so we also had threads going on with Mary Lee, and we had threads going on with the staff on the campus to keep track of what everybody was doing and where each building was in the process of the evacuation. And then also on the campus, we had set up a Teams meeting, and we had one person monitoring and it was actually somebody from our sales team was monitoring the Teams meeting, and we could pull that up on our phone, and you could just jump on or send a text or a message into the Teams what your community needed. So within our own campus, we were coordinating through communication through our Teams app. So.
Yeah, I think another practice again for our partners to think about it. Once you get past that initial life safety scenario, is establishing a regular planning cadence with key partners, which did happen with healthcare facilities, with the state health department, and others, where they met regularly to start to talk about again, even moving towards that reunification area where folks are going to get back to their homes. So that is something I think groups think about, leveraging those structures we have now, those best practices we have, working again with healthcare facilities, with the state health department, working with public health and our teams there, working with the homes in the community, meet regularly and come up with plans, share information, share situational awareness. I think ultimately we've had good outcomes as we transition towards more of a recovery as part of this response.
And just being connected and being good stewards of those connections. The facility that I ended up evacuating my assisted living residents, we had an MOU with. The other facility, not so much. We didn't have anybody set up that was, our skilled partners were also being evacuated that we had MOUs with. But my director of nursing, who happened to be in Mexico, but does belong to a Facebook group of other healthcare directors of nursing from Mexico, was able to put out a message on Facebook that we needed a location for, and within a half an hour, we had several locations, and I had one facility that could take my entire skilled population and send transportation to help us move them. So, it's the partnerships that we maintain and manage and that we're good stewards of. You can't just put them in a disaster plan and walk away. The disaster plan, at least for where I was going to move my skilled people, did not support me that night. It was our networking that got us where we needed to go.
Absolutely, I would agree with that. I think the reality is this, unlike many disasters that we faced, this was one where all of our local partners were as affected as we were, and so it's absolutely important to maintain those connections, maintain your relationships. For us, we ultimately had to move our residents to a rally point and then find housing for them from there. So it was only because of the connection that we had to CHCA that we had beds and were able to unload those beds and get our residents put down. It might have been 3 a.m. by the time we were able to do it, but the reality is every single person went to bed comfortable that night because of those partnerships, and it really, for me, demonstrated how important it is to not only maintain those partnerships, but to make sure that you are a good partner in return.
So Michelle, how did you track your residents that night?
So we have a resident roster that we maintain, and because transportation was pretty compromised, I would get about a 5 to 10 minute warning before transportation would hit our doorstep, and so I'd hear what type of transportation it was, if we had a wheelchair lift or not, so that I could plan who was actually going on the bus, and then I would update that roster with what bus number the resident was going. We ultimately knew the first location that all of our residents were going to, and then when we arrived at Balfour Longmont, we actually had to find placement for all of our residents from there. So then we had to follow that process again to get both them, their medications, their medical records and everything to the appropriate level of care, and then just make sure that we deployed both staff and other resources to them from there. Ultimately, we were evacuated to those 3 deployment points for about 3 days, and then ultimately returned to Becky's community, where we were housed for about an additional 2 weeks before we returned home. Ultimately, our community sustained some damage from the fire that wasn't made apparent until we lost our dry sprinkler system about 30 days after returning home. So we have actually been back at Becky's community for about 9 months and are headed home in about 30 days. So sometimes you have aftermath from these disasters that is pretty surprising.
It goes on forever. So yeah, ours was a little bit easier. I mean, if anything was easy that night, it really wasn't. But I have, being assisted living and skilled, we have 2 entrances to the building. So we did print off our rosters for both sides of the building, pulled the office staff, and immediately, like I said, we sent it out on LifeLoop, hoping that all my families and my staff can get the notifications either by email or text. But we did call all of the families, and I had people stationed at each door, and as the buses came up, we listed who was going. Because we didn't have that much transportation and a lot of people were going in personal cars, I was making sure that we wrote down who they were going with and the identification of the car as they went, and then checking them off. And we were fortunate, and that's what I was going to say, we only had 2 locations. All my assisted living people went to one, and all of my skilled went to the other. What happened in a couple cases, though, is I had families that took residents home, and we knew they were taking them home. However, I did have 2 families that picked up their residents, and we thought they had taken them home, but I guess we should have clarified it that night, because they actually showed up at Michelle's facility evacuation in Longmont, because they didn't know where we were evacuating to. They had just heard the conversation that one of the facilities was going to Longmont. And then I had another resident that showed up at the hotel that we had secured for the independent living, and the family just took them to drop them off. So the family was just being transportation. They weren't planning on taking them home. And I think the assumption was made that if the family was picking them up, that the family was going to take them to their private home. And so we weren't asking. So the lesson learned, if the family picks them up, where are they taking them to? And if they want to bring them to the evacuation site, that's fine. We just need to know that they'll be arriving so that we can plan on them being there. I think the interesting, and I know Michelle did this too, because we talked about it after we thought we had everybody secured, we went, of course, door to door, and you mark your doors and you check the apartments, but we cleared our building 4 times. And then I had to come back to the building because we had missed taking, we needed additional oxygen equipment. So because we weren't on fire, I came back to the building. It was completely empty. To pick up oxygen equipment at 3 in the morning, and I had to clear the building again. And I just could not walk into the building and not clear it one more time. Even though up to that point we had everybody, but You know, they had gone so many different places and it had been so chaotic. And that's when I started second guessing myself when I had families that had taken residents, but then we're bringing them different places and dropping them off. I'm like, now I'm not sure that we know that all the residents went with their families. So that was the first thing we did the following morning, is recall every family to make sure that they knew where their resident was, or they had the resident and that their night had gone fine, and if they needed anything as far as support from our staff. And so making sure that the families were aware and that we were getting a hold of everybody. And continual alerts on our life loop, letting families know where we were, what was happening. We made it through the night, everybody was good, and things like that. Life Loop, I keep referring to Life Loop. Life Loop is an app that we use within our whole company it actually is on a TV screen with our activity programs, but it has a whole communication module that we can reach families, staff, we can have them in different categories, and you can send either a text message or a email or attachments in mass to large groups of people. And it's nice because I can do it from my phone, I can do it from a computer, I can log in. Because it's an app, I can go anywhere and do it. And so I can be at a different facility and sending out messages to families. It also allows families or staff to text me back or email me directly through my app without having to know my phone number if they didn't know my phone number. Yeah.
I wanted to ask our partners about the staff, your staff, and how they were impacted, and if how you have supported them, if there's long-term impacts to staff. It'd be great to hear from you.
Absolutely. At our community, we had one staff member who did not lose her home, but who did have quite a bit of smoke damage, in the long-term effects of the fire. But we did have several staff members that were affected by the impact of the evacuation itself. So we had our 6 o'clock team, 6 o'clock to 2 o'clock team on board when we began our evacuation planning, and ultimately had 2 staff members that needed to go and assist their family. We were very lucky to be well-staffed and able to respond to the evacuation despite that. But ultimately, we saw quite a bit of trauma response in both our residents and staff after the fire. Certainly had individuals who experienced extreme exhaustion, just in the immediate aftermath of responding, but, difficulty with sleep, difficulty with just processing everything that we went through. So for our community, we actually established a support group that we kept going for about 90 days after the Marshall Fire, and that actually came through through a local mental health group that assisted with pandemic support groups in our community as well. So it was another opportunity to connect with our partners. But we definitely, I think the biggest impact to our staff was ultimately for those that were a part of the evacuation in the immediate aftermath, a huge resurgence of the sense of community in our team. As much as there are hugely traumatic moments in a situation like this, I felt such a deep sense of family and gratitude for everything that my staff did. I remember the following morning after the fire, our main evacuation point was Alta Vita Longmont, and we had basically everything that we were able to bring with us. One of the hallmarks of memory care, obviously, is programming. It is in all of our communities, but we didn't have anything to support programming that morning because we had evacuated a fire. And so the first activity that we did that day was playing snowball fight with socks. And I remember feeling such an immense sense of gratitude and exhaustion at that moment, just that my team was willing to play with my residents after such an unbelievably traumatic 24 hours. And it was moments like that throughout, especially that first 10 days after the fire, that really were what kept our heads up. And ultimately what has come from that has been a really deep gratitude for the deep commitment that our teams have for our residents and our teams and what we are here to do every day. So as much as it was a really tough experience, it was also an incredibly profound one for me. And I'm as weird as it is to say, I'm really grateful that fire happened. So.
One of the things that we had been asked about at one time is coming back to the facility and what it took to come back to the facility. And again, my facility was very fortunate. We never ended up being part of the fire. However, we did, because we had chosen to evacuate, Boulder County did come in and take a look at the building, and life safety from CDPHE came in and made sure that the building was ready for us to come back. So that took several hours, and a couple times I thought we were cleared. It got very confusing. So I think knowing who has to clear your building in your county, because I was told it was one group and they cleared us, but then I was told they couldn't tell you that you could return because somebody else had to tell you. So I had the residents on their way back, and then I had to send them back until we could clearly make sure that we got back into the building. And checking people off and letting families know. And actually coming back was kind of like the fun. We did a huge party as each person came in. We cheered and made sure that they felt loved and that they were back in their community. But one of the things then, we couldn't use the water. So we did come back to the building, and then we needed water. So again, we went to our Facebook friends and put out requests for water. And the next thing I know, we have a semi truck pulling up in front of the building, unloading a full semi worth of water into our building. I didn't even have enough storage for all the water but it was perfect. I couldn't have asked for anything more. And then helping coach our residents through how they were going to, that they couldn't drink the water in their rooms. They had to use the bottled water. Was a little challenging, and I'm sure that was even more challenging with the memory care. Because you can't turn the water off at the faucet, so it's a little hard to do.
I do want to go back to the staff support and that mental health component. Mm-hmm. It's throughout the pandemic response for us, and particularly for our public health partners that are listening, it's a best practice we established. Early on we weren't supporting our teams enough, and we learned that go out and seek those resources. We have regular sessions available to staff, and it's really important. So this was during a long-term response for us in public health, and it hit during the holidays. So it hit home for a lot of folks, and it was a really challenging scenario. So it's been recognized that practice for us of really being proactive and supporting staff with sessions, group sessions, or individual sessions, and making those available to them to work through very traumatic scenarios should be one of the first things you think about for your staff and those responding. And this was recently recognized by the National Association of City and County Health Officials. So we're proud of that, and I would just again encourage folks listening to really think about that as you work through these disaster responses.
Yeah, and don't forget your EAPs, your employee assistance programs. I was calling them that night to see if they could deploy counselors to our buildings, but then making sure that the staff all had that contact information. So I made sure that went out to every one of the employees and encouraging them to take advantage of their employee assistance program and the counseling services. Because I know for myself, I suffered some quite, I know it was exhaustion, but just when you looked at the magnitude of what we did that night and then being back, and I cleared a building and returned them within 36 hours. That was a lot to ask of people and their emotional health. So not forgetting that in the especially in that first honeymoon phase when people are coming back, they're so happy to be back, and you think, I did this is great. It's the couple days, it's the weeks after that where it's like, oh, there's nothing left of me.
So I think another component to think about is how you structured during the response. Some folks in their emergency operations plans might have an incident command type model. So I'll be curious to hear how you structured with this disaster.
Mm-hmm. Absolutely. I think Becky will probably echo a pretty similar experience, but I was fairly new to my role at Balfour when the Marshall Fire took place, and I'll be honest, I cracked my my disaster book open probably a month after I joined the community, made sure that I had one there, checked it off in my brain and said, I'll get back to this at some point. And ultimately, on the day of the fire, there wasn't time to pick that book up. I have to be honest. I walked outside. I remember that morning I woke up and it was the day to put the trash out, and my trash bin was already across the street when I got in the car for work. I remember noting the heavy winds early that morning, but it wasn't until I started smelling the campfire smells that I started to say, we might need to think a little bit here. But ultimately, when we made the decision to evacuate, our team really just kind of started a tabletop exercise in that moment. We gathered around the table, and I really just had to say to my team, I'm going to probably have to ask you the hardest thing I'll ever have to ask you in the history of this community. And I know that we're nearing shift change, but I need you to stick with me. I need you to pack 3 or 4 days of clothing for these guys. We just provided every team member with a different assignment. So whether that was maintaining our residents calm during that period, whether it was preparing them physically themselves, whether it was gathering supplies, making sure med carts and computers and all of the things that we would need to provide even just the next 24 hours of care were together, and then ultimately planning how to get all of our people, our equipment, our staff and their vehicles to those rally points so that we could join up with other staff. Was definitely an intense effort, but it was, I think, the most important lesson for me there was not only the planning and the importance of teaching your staff critical thinking in those moments so that they are empowered to make the right decisions, but having a culture that supports that your team wants to do that with you when the going gets tough. And so I think the investment in education as well as culture were tremendously important, learning points for me.
I would certainly agree, and we did not have time to set up incident command. Michelle's right. I had very little. I knew I had an emergency plan, but I had only been there for a few months, and I had not really dug into it. But I have had a lot of experience, and so we did the same thing. I ran it like one big tabletop. We pulled everybody together. I gave them their assignments and went in and made sure that they were going to be reporting back to me. We were all using text, so we all had our phones. We were texting each other. And so in that sense, I know somewhat of an incident command, but certainly not at the extent that we've learned. There was no time to set it up. We were moving too quick. And we were also, when this was happening, I did have staff. I had a handful of staff that lost their homes that day and had to, we were on Christmas break, of course, so kids were out of school. So we had, 14-year-old brothers babysitting 8-year-old daughters in the evacuation zone, and mom was at work, and mom had to get across town to get the kids. There was nobody else to get them. So supporting them and not making them feel guilty that they had to leave. They had other people to take care of. But I will say, for every employee that I lost that night, I got a volunteer. And so knowing that you need some kind of way to track your volunteers, I don't think we did that very well, and that is something when we're looking at our plans, how we're tracking our volunteers, and who's putting hands on our residents and who's touching residents is very important. But I had, like I said, for every staff person that left, I had a staff person's spouse come in, or their parents came in to help, and we had people from the neighborhood that had been over to volunteer and had come to visit residents wanting to know if they can help. And so knowing who they were and having a quick way to identify how best to utilize them was very important to us, and who had what. We go back to that night of transportation. We didn't have a lot of good transportation. So I had a couple spouses and friends that showed up in pickup trucks, not thinking that I was going to ask them that we could use their pickup trucks to throw equipment in, because every spare space in cars was taken up by a resident. So we were loading our lifts and our wheelchairs and stuff in people's trucks because they had shown up with them. So, and they were happy to help. So.
And I know our partners might have questions about repatriation, so I don't know if you could discuss how that went for you.
Absolutely. So we returned to our community about 3 weeks after the Marshall Fire, and we planned it really as a big party. Our team was so excited to bring our residents back that I had staff members volunteering to make banners and play music and create special outfits for our residents and do their hair so they looked great. So we had our home office, many of our family members, our chef created a beautiful surf and turf dinner, and it was a really powerful day of just bringing everyone back and getting them reunited with home and seeing their things and just having that sense of being home again. It was definitely a very powerful moment for me. I remember after I cleared the building for the last time before I walked out on the night of the fire, I had that moment's thought of, I have removed people from a place that has not had the doors closed for 25 years, and to be able to reopen those doors and return our residents was awesome.
So Michelle, can you speak a bit to the triage system and how you tracked that system?
Absolutely. Our community has a large town square, so as our residents were prepared to evacuate, we would have them delivered into our town square. Because we were trying to move at a very rapid pace, it was really instant communication about what the next vehicle coming was. And so depending on the type of vehicle that was arriving, I would have to match the residents' needs. So I really stationed myself right at our front door with the resident roster, and as I planned which bus the resident was going on, I would add that to our roster, update our staff that that resident was going, check them off as I saw them leave the community, and then ultimately when I took photos of those rosters, sent them to our team catching residents at Longmont so that they can confirm that everyone that I said was on that bus was actually on that bus, and then I assigned a staff member to every bus so that they would be responsible for that, 8 or 9 residents on the bus. And then obviously as we had to plan new deployment points, we would have to begin that system again. So it was a bit complicated. Ultimately, you would add columns and columns and columns to this spreadsheet over the course of days, but we were successful in keeping everyone safe and together and with the equipment and supplies that they needed. So it's definitely a bear at times, but it can be done.
So the staff that went on the buses, did they stay there or did they come back? I mean, how did you manage the staff on the bus?
So most of our staff members that were on the bus were from our 6 o'clock shift, and unfortunately, we had to ask them to leave their vehicles at the community, which when we left had flames about 600 feet from the doors. So it was a little bit of a tough ask, but they went with our residents and stayed with them until about 1 in the morning, and ultimately at that point we were able to reunite with our overnight shift and get some new help in. But we actually had to give all those staff members rides back to the building in the night and gather their vehicles. At that point the major harm had passed. So they ultimately were pretty nervous about whether they'd have cars when they returned, but just traveled with our residents and made sure that they were comfortable and safe, which was great.
Yeah, that's what we did too. I was able to, my night shift, I was able to get out again on the life loop, and through texting and email, my night shift was able to report to our evacuation site. So I divided them up and had them report, and it was very nice. I should say our partners, our hospice partners, other partners that we work with as far as providing services to our residents also sent staff to help. So we had our agency staffing were sending extra staff to help us even without asking. So we were getting staff there. I was worried that we wouldn't be able to get staff to our evacuation areas, but we were able to.
So once you got to the evacuation sites, can you speak a bit to how that process went with, getting the residents in the building and kind of adapting to that new environment?
Yeah, so I went with our skilled residents, and so I can't tell you exactly how it went with our assisted living residents who went to Fraser Meadows, but I believe, and they said that they were very welcoming. Years ago, we had brought in Fraser Meadows residents when they were flooding. So like I said, we had an MOU with them and they were very welcoming to our residents and brought them right in, and we had people settle them. Now in this skilled area, we were fortunate enough the Gardens on Quail had closed their second floor. And so they let us have their entire second floor, which they hadn't remodeled yet. So there were still some beds up there. I knew it looked like people had evacuated it. It was all empty, but we were able to go in and make it our own. So that was the best case scenario I could ask for my skilled residents. They had their own rooms. The staff we had staff stations. We had place for the med carts. We had places, they brought us a refrigerator, so we had places to keep refrigerated meds and things like that. So that one was not planned in advance, but again, through our Facebook connections, we were able to be connected to a whole facility that was standing empty and somebody gave it to us.
Absolutely, and I would say our experience was pretty similar. Our initial evacuation point was to our sister community in Longmont, and obviously mixing two memory care communities together for a couple of hours can be a little bit complicated, but that was fairly short-lived. We were able to transport our residents to our three more permanent locations a few hours later, and because of the time of day, we were lucky in that all of their residents were in bed, and so it was a pretty organized receipt of having their department directors actually there to receive us as well, which I very much appreciated, and then ultimately just deciding how to deploy our staff to each of the three facilities that we were at, and from there I decided that I would just twirl each facility every 8 hours and make sure that all my residents were okay, and then we were lucky enough to get back under Becky's roof a few days later and everyone was together again.
So, one of the things on our way to the facilities, how I've been asked often, like, how do we manage our medication and our oxygen? So our oxygen is portable, and we have concentrators that plug into the wall. So we were able to take those. Our portable oxygen is actually liquid, and so we can't really take the liquid tanks. So we did fill those. We filled the liquid tanks and took them initially with us, and then that's what I had to come back at 3 a.m. because we had taken everybody with their liquid, but then it was running out, and we hadn't grabbed all the concentrators. So I needed to come back and gather all the concentrators. So on the emergency plan that went, not to forget those. And because both of my facilities went to one location, so Michelle's probably gonna have a different story, but because mine went to one location, I took the whole med carts. We did not take them out and put the meds with the residents. We took the entire med cart and took them right to the facility so we could give the medications from there. The computers and everything were right there, so we could pull up the MARS and the TARS, and the resident medical record was all right there. So we were able to take it with us. And I don't know how you divided them up.
Absolutely. We did bring our med carts on one of the vans that went over to Longmont. We were lucky that we were able to keep about 35 of our residents all together. So we had 8 that went to one facility, and we had to send their medications and one of our computers with one of our med techs to that community. And then for our second community that we had just 4 residents at, they actually took over care of the medication part of our residents' care during that time and just asked us to provide care staff support. So again, our partners were wonderful in stepping up. And then one of the bigger challenges for us was pharmacy coordination after the immediate event, because we were out of our community for such an extended period and moving a bit like gypsies from community to community. We had some missed deliveries and having to go trek back to a community to pick up a medication and stuff like that. But ultimately that was probably a 3 or 4 days of clunky communication until all of our partners knew where we were, how to communicate, and we had our communication infrastructure back up as far as faxes and everything like that. So, it really, you kind of go back to basics and use the phone and use your car and go and get what you need, but ultimately everyone comes together and gets you back to really good service very quickly with those partnerships.
Yeah, we were fortunate. We were back before anybody realized we were gone. Yeah, so I just wanted to clarify, because I mentioned it early, the MARS and TARS. So a MAR, the medication administration record, and the TAR, the treatment administration record, so that the nurses and the med techs know the medication and the route and the what they need to be giving to people at what times are on those records, and they're on the computer. And so you can have the medication, but you need to know how to give it to them, and that's why they needed those computers too. So we were able to bring those with us also.
So important aspect for our partners to understand as they're watching this discussion and training is what's happening and what was happening in this particular disaster incident at the Office of Disaster Management and Emergency Management. So we had an unprecedented evacuation of a hospital. We had a second, a Vista hospital. We had a second hospital being evacuated. So we were supporting that as ESF-8. Additionally, we support those community members that get evacuated that have access and functional needs. So they potentially need additional support. So for the partners to understand, it might be challenging initially in a fast-moving incident like this to connect with public health. So the importance of preparedness and really acting, having your teams together is something that really we learned from this incident. And just knowing and framing that the roles at the offices of disaster emergency management sometimes can be taxed. So the group needs to continue that preparedness planning, walk through all these different scenarios to understand they may have help, they may not. I would also encourage the group that are watching, if you're looking at other incidents like a severe winter weather scenario, certainly contact public health if you have an extended power outage. That's where we can work together. But also know as you're walking through your scenarios together, that support might not be there. We knew, for example, it's clearly our first responders were taxed, the 911 center or call centers or dispatch centers were getting a ton of calls. So just think about those scenarios and play those out and be prepared to act.
So I think it would be really important for us to, part of this training is to really talk about what we did. How have our plans changed now? And I will start, speaking for me, they've come off the shelf. And it has to be part of every day. And, you know, who knew? Never in my wildest dreams would I think that we would have had a fire that affected our whole community. I used to live in the mountains. I know that the fires happen there. I never would have thought that when I lived in the city that I would have to deal with this. And so really opening my mind and looking at the different types of scenarios, and, you know, we're not always going to defend in place, and how are we going to leave? And are we going to leave over a 2-day period of time, or are we going to have to get out within the next hour? And how do we make that happen? I feel like we could have done things a little bit differently and been out of our building quicker. Had there really been a fire right there? I know other facilities have had to leave in less than 4.5 hours, and that's how long it took us. So, you know, I think that's just really looking at each aspect and then looking at the partners and building in a fabric, not just with us, but a fabric from the team and the community.
Yeah, I think for the community, preparedness is front and center now. And so the Office of Disaster Management has worked with us, and we brought together basically a coalition again of a lot of the long-term care assisted living homes in the community. We mentioned there's 40 plus, 42 of those in the community. So we have brought those together again just to walk through a similar discussion as we've done here. What are you looking at for plans? What are your gaps? Transportation gaps, how do we work together to fill those so that homes can talk to them and say, hey, I have these transportation resources that are available to you. Potentially this could be somewhere that you could bring community members should they need to be evacuated. So those conversations are starting up again, have been really successful thus far. And I think everyone's doing the same thing. They're really again taking a hard look at their plans. I think we know that these incidents, these disasters are not going away. And so we as a community need to continue to be prepared, have these conversations with partners, and hopefully and ultimately I think because we had these things in place even through the pandemic, we were lucky with the outcomes. Folks were safe and ultimately were able to get back to some sense of normalcy after this disaster.
Yeah. One of the things, Chris, I wanted to bring up is that, and we've noticed as we've been doing our plan, is that a lot of the resources that we had set up are the same resources that every other facility that was evacuated that night also had set up. And And so now a resource you thought you may have had is not available because somebody else is already using it. So, you know, it's having depth in your plan, having plan A, B, and C, and then being ready to develop D on the fly.
Yeah, that was definitely actually the point I was going to bring up is, you know, you absolutely need to have that depth to your plan, both in, you know, having a deeper bench pool of partners to leverage, as well as just making sure that you understand the role of the different resource agencies that are around you. I think the conversations that we've had since the Marshall Fire about actually hearing what the role of fire and EMS and the Office of Disaster Management and public health are in those moments is so beneficial, because we all assume in that moment that, of course, I'll just call OEM. But when OEM is responding to everyone, you have to make sure that you have the availability to help yourselves. And so having those tabletop exercises and saying, great, we've attacked plan A, but now we're going to take away resources X and Y, and now rebuild your plan from there. Oh, wait, we're going to take away resource Z. Let's do it again, has been really frustrating, but an incredibly important exercise, because that's actually what happened that day. You know, the communication was, for me, was walking out to the side of McCaslin Boulevard and talking to the fire department on the street about what I should do next. And sometimes it really is as simple as, you know, going outside, looking up, looking out, looking at who you can talk to, and figuring out the next best place from there. But it ultimately is all the critical thinking, all the relationships you build, and all of the lessons that we learn in moments like this that can help ourselves and our sister communities. So, ask your sister, the other thing that's been really beneficial for me is asking our sister facilities what's in their plans, because I'm not the smartest person in the universe, and Becky has wonderful resources, and our sister, our partners that aren't even part of our own company have been so wonderful in sharing those resources. So, call your neighbor, honestly, because you will hear things and learn things that you didn't expect, and they will make your plan stronger and deeper. So.
Yeah, I think the only other thing I would add too, is typically facilities have MOUs with, another facility that may be across the state. So looking at more local support, in Boulder County, if you're a facility in Boulder, look for someone in Longmont that may not be evacuating. For example, if you're potentially looking at a high wind day and a fire risk, look at developing partnerships with local facilities that are within your county, and maybe having, they have a 15-person van and you're setting up, hey, if we need to call you, can we borrow your van if you're not using it that day? Can we borrow, staffing, other resources, other things you may need? So developing the networking, your neighbor, more local, relationship building, I think is a huge thing within moving forward and including in your plans, and practicing the plans, within the staff, not necessarily physically practicing the evacuation, especially as if that could cause trauma and other unnecessary things, but making sure your staff know where it is, making sure your staff who are overnight know where it is, and how you would kind of activate your plan and your command system. So kind of a full collaborative process within your facility.
Definitely. And I think, as you said that, the one thing that struck me is, the Marshall Fire happened on December 30th, which, for many of us in our industry means that a quarter of our staff is off celebrating holidays and stuff like that. So it's also talking about the bench strength on your own team. For Becky and I, both of our wellness directors were not at our community. So who do you empower if your nurse is not there? Who do you empower if your director of facilities isn't there? Who knows this stuff so that you can continue to operate at the level that you need to in those moments. And so, making sure that you have that bench strength built, but also expressing confidence in your team in that moment was very important, that they heard that we were confident in them and that they knew that we would get this done. So just building out that plan for the what ifs and the what if you're not here? What if your team isn't, a critical member of your team isn't here, and who can be their backup?
Well, and that's a good, making sure that people know your plans, because when they aren't there, they were, like, my wellness director was able to call in, my director of nursing was able to call in from Mexico and know how to support us because she knew the plan and what we would be doing that night, so how she could help us.
Yeah, I think the other part too is, facilities are the ones who are making these decisions. They're the ones who are adapting plans. You're the ones who are really doing this work at that time when they're necessary. But Colorado Department of Public Health, the State Health Department, local public health, us with Boulder County Public Health, and the Office of Emergency Management, we all collaborate. We're all in communication, as these situations arise, and so utilizing us. But also, knowing that, I don't know, you're the ones who are ultimately making the decision. So we're here to help kind of behind the scenes and help prepare for future disasters and reviewing plans and stuff like that.
So about when we had evacuated about 75% of our residents, the barricades on McCaslin Boulevard weren't allowing our vans through anymore. So we had about 8 residents at that point that were still in the community. We took an assessment of which staff were here, and we ultimately had 6 residents that would have been able to get into a car and 2 residents that were medically compromised enough that we wouldn't have a vehicle that would be safe to take them. At that point, there was no option to call 911, so there was no ability to call an ambulance for assistance at that point. And so really at that moment, we contacted the police department, explained the situation, and hoped that they would be able to get in touch with the person managing the barricade. But ultimately, unbeknownst to me, our partners at CHCA had deployed the RTD buses to us, and we had 2 stretch RTD buses pull into our driveway when I was basically at that point where I was going to say, I'm going to sit in this building with these 2 residents and pray. They came around the corner, and we were able to load up the 8 residents into the buses rather than into our personal vehicles. We had 24 wheelchairs sitting in front of the building in a cloud of smoke that I wasn't sure how to get back to our residents, and I was able to load those onto our vans as well as our remaining staff. And we created a conga line of our remaining vehicles and the 2 RTD buses and our police escort, and ultimately had to, the fire was so developed at that point that we were crossing the street against active fires to avoid being too close to the flames as we got out. So it was pretty intense at the end.
So, we talked about a lot of stuff today, and I just want to thank you guys all for coming and being part of this, and for your dedication and service and everything that you did that night. And as we wrap it up, I want to thank all of you at home for joining us and taking the time and giving us the opportunity to kind of share our thoughts. And it could be you. I never thought it would be me, but it was. And so be ready, pull out those plans, be ready, work with your teams, work with your counties, and get those plans. Thank you, and stay safe.
Hi, my name is Melanie Roth. I'm an Emergency Preparedness and Response Coordinator for the Health Facilities and Emergency Medical Services Division at the Colorado Department of Public Health and Environment. So we license all of the healthcare facilities in Colorado, or the healthcare entities in Colorado. So naturally, on the 30th of December, as we're all getting ready for New Year's, I was at home, working remotely during COVID, and I could actually smell the smoke. I live about 15 miles away. I could see the smoke. So I was just, went back inside and started working, and then was notified by the leadership in our division that there was a fire in Boulder. So our core team in our division immediately got together and made an action plan of how we were going to, check on all of the healthcare facilities. So we use GIS mapping. That's Geographic Information System Mapping. And it actually shows us where all of the health facilities are located in Colorado. And in addition to that, we had one of our colleagues map in where the fire started. So, as I said, we had a meeting. The department also had an emergency meeting right away with a lot of the groups that, air quality, water quality, because everything's affected by a fire, air quality, water quality. We had COVID going on, so we had a department meeting, then we had a division meeting, and then we got started. And so again, using the mapping and where the fire was currently, we started contacting health facilities, just looking at the map, who's closest, and we just started calling everybody. And our purpose in calling is to check on the community, to find out their status, whether or not they are, close to they were close to the fire, but asking them about their, whether they were, had received a pre-evacuation notification, if they were planning to evacuate, what steps were they taking. The two really important things that we always ask is, transportation and where the residents are going to be going. During that first call, it's just really important to let providers know that we are there as a partner, that we're there to help them, and to get them, anything that they need. Of course, Boulder County was the lead, Boulder County Public Health and Boulder County OEM. But we also have, close relationships with all these health facilities. And in addition, we have federal and state reporting requirements. Our jobs at the health department in our division is to make sure that the citizens and visitors to Colorado that are in healthcare communities or receiving healthcare, that they are safe and healthy. So we just immediately put a team together. We had people from each program: assisted living, nursing homes, hospitals, home care, ambulatory surgical centers, outpatient emergency centers. I mean, we were calling all of the facilities. We had a number of people working on it to check on the status of the communities and to see what they needed moving forward. So, and of course, everybody was freaking out. Everybody was in the midst of getting ready to go. There were, we also, because we have relationships with providers, we got a lot of calls. One facility called and said, I just looked out the window and I see fire outside my building. Should I evacuate? And we said, absolutely. So one thing I learned from that is, in addition to, of course, having kind of, redundancy in who can make decisions about evacuating, but also about empowering staff to know what to do in an emergency, and if they have to make that decision that they have to get out, that they are empowered to do so. Again, because we had communities, some that, maybe had waited too long, but as you probably heard from others, once you know that you have to evacuate, things move very, very quickly. One thing is just to make sure that you have in mind where you will be going if your community has an emergency. Not just neighbors or communities in your area, but also communities that are outside your area, so that if there is an emergency that occurs and all of the communities in your area are impacted, that you have somewhere to go. And we always encourage communities to have memorandums of understanding, MOUs, where they actually build relationships with these other communities so that they can plan for what they will do in an emergency. What will the receiving community be able to provide? We always encourage communities to take their as many of their staff as they can with them. Of course, some of the staff that lived in the area were impacted by the fire, but we encourage communities to plan, in advance how they're going to evacuate their residents. So, having go kits for the residents that include at least, 3 days worth of clothes, and toiletries and assistive devices and batteries for hearing aids. And, we encourage them to label all assistive devices with a resident's name and the community that they're coming from. When communities are evacuating, we encourage them to look at the number of residents that are in wheelchairs, the number of residents that use walkers. That impacts the kind of transportation that they need when they're evacuating. So we encourage communities to make some of these, to look at these issues and make these decisions before something happens. That's the whole purpose of, preparedness.